Nigeria is well into its second wave of the COVID-19 pandemic as the country continues to record a spike in the number of cases. In the last 1 week, Nigeria recorded the highest number of cases since the virus was first discovered in the country. The center warned that the nation could pay in January for disregarding the health protocols. And while vaccines may well be on the way, the country is battling extra resistance of COVID-19 as people are getting reinfected with the disease. A new strain of coronavirus has also been discovered in Nigeria, different from the ones in the United Kingdom and South Africa. Well, joining me via Skype is a public health specialist and public relations officer, Association of Public Health Physicians of Nigeria, Lagos State Chapter, Dr. Blossom Maduafokwa. Good morning. Thank you for joining us on TVC Breakfast.
Good morning. Thank you so much for having me.
All right. Now, this new strain has raised a lot of concern, not just for the NCDC or the Presidential Task Force, but for a majority of Nigerians who do not seem to understand the difference. Talk to us, help us better understand this new strain and its spread.
Okay. So when you talk about new strains of virus, you have to understand something about viruses and the way they mutate. So viruses mutate very rapidly. So it's almost like someone typing very quickly or very fast on their computer. You're going to have typos. So when viruses mutate very rapidly, they have replicate rapidly, they have mutations. A lot of time, these mutations occur without the virus acting any differently. So the virus will not become more virulent. The virus will not change its character. So it's like having a typo in a document, but when you read the document, it still sends you the same message. So, but what happens when we have a new strain, like the reports we're getting from the UK, for example? So this new strain now has a different character. So the different character it has is it's more easily transmissible. So that's what happens. So the new strain in Nigeria, we're still trying to understand how differently it behaves from all the other ones that we've had in the past. So two things I'm going to say to the public is, first of all, do not panic. Viruses mutate all the time. Secondly, if the virulence does not change or it doesn't become more virulent or it starts to kill more people than it usually did, I think we should be a little bit more cautious in our level of panic. So these are the two messages I'll have for the public.
All right. One thing that we know about this new strain is the fact that it is not responding to the vaccines that we already see being produced. And the vaccines are said to offer great hope to turn the tide of the pandemic. So isn't that concerning?
Okay, so we don't know that yet. So there are studies that are currently being carried out to determine. So you have to understand how the vaccines work. So the vaccines work in helping an individual develop an immune response to the spike protein. So this new strain still has the same spike protein. So when an individual that has been vaccinated comes in contact with the new strain, that individual's immune system is still going to be able to recognize that spike protein and will be able to mount an immune response to the virus in the future. So we don't know yet that the vaccines are not effective to the new strain. It's studies that will be done subsequently that will tell us for sure that they haven't been. But what we currently know is that the new strain still has the same spike protein that the vaccines are supposed to help you develop an immune response to.
Now, we see that the numbers keep increasing, which you rightly pointed out earlier. And there are concerns. Even we see the Presidential Task Force talking about Nigerians having to bear the brunt for the activities they carried out in December, in January. And when you look at our health facilities, the capacity to address to manage rather, the number of cases that will be coming up is also of a concern. What can be done at this point when we're looking at addressing this number of cases that are rising? And we also have the fact that people are seemingly finding it difficult to take responsibility.
You raised a fantastic point. And in fact, I mean, we almost sang this like a song 2, 3, 4 weeks ago, but almost pleading with people, avoid crowds, wear a face covering if you have to be outside your home. If you don't have to go out, stay indoors. Because the spike that we're seeing today is as a result of the activities that we carried out 4 to 6 weeks ago. And the behavior that we are exhibiting today, we're going to see the consequences 2 to 4 weeks down the line. So this is something that, it sounds so simple, but it really works. If you don't have to go out, don't go anywhere. The only thing that we can do is to protect ourselves from now till 4 to 6 weeks down the line. The things that we do today, if you don't have to be in a crowd, please don't be in a crowd. If you must go out, wear a face covering. I go out and it breaks my heart. I see people with their face coverings on their chins. Why? Just wear the face covering. It works. Studies have shown that it definitely works. So these are the things that we keep singing and pleading with the public. But I mean, I think people are basically just tired of putting these protocols into practice. But we have to stay on this because we're almost there.
But do you think that perhaps the government might need to change its tactics at this point? Because there are lots of myths around this whole pandemic, and there is also the trust deficit between the government and the people. And the crisis communication for some persons seems to be also a major concern.
You're exactly correct. And that's why, even from the beginning of the pandemic, there's something that we've promoted. It's called community engagement. You must engage with the community, with the grassroots. I mean, if you walk into, can you imagine walking into, say, one of the markets in Lagos and just telling a bunch of people, oh, go wear your face covering? People are just going to ignore you. But if you're able to get the buy-in of their leaders, they have leaders at these levels. They have the leaders of even the area boys. If you get the buy-in of those leaders, then you can get the message down to the people. Because the average man on the street, the average woman on the street does not trust what the government tells them. People tell you, oh, this whole thing is a hoax, this whole thing is just a way for the government to make money. So people don't believe it. So we need to gain the buy-in of the people at the grassroots through their leaders. And that's how we get our messages across.
There's also the aspect of some persons saying perhaps those who had recovered should be involved in the campaigns or advocacy towards ensuring that people adhere to the protocols being put in place. Do you see that as another aspect that can be explored in our crisis communication at this point?
That is correct. And we have found out that has actually worked in the past. So we've had, during this pandemic, we've had a bunch of celebrities that had the infection and actually came out on using their social media platforms to tell their stories. And those things actually worked. There's something that happens when someone that has had an experience comes to relay their experience to you. The person is not in the government. The person is not trying to make money off of you. The person has nothing to gain from you. And when the person tells their story, there's something that happens. It sort of brings the experience down to the common man. So those things actually work. I mean, using influencers at this point, we use influencers for everything else. Why can't we use influencers for this life and death infection?
So another issue I'd like for you to touch on is the fact that the PTF is, the government is asking state governments to perhaps take this battle more seriously, because it has spent at least 1 billion naira across the states, and in total about 56 billion naira, and is asking states to perhaps begin to push this fight such that it gets to the grassroots. I wonder what your response would be, looking at how states are handling all of these issues at this point.
To be honest with you, from my observation, I mean, some states have taken this more seriously than others. But I can tell you that I don't see the same level of response coming from every single state organization. And we have seen this play out in a place like the United States, where one state takes the response very seriously and brings down their numbers. Another state has a completely different plan, not taking it seriously, and the numbers go up in that state and adversely affects the state that already brought down their numbers. So we have to have like a more national approach. Yes, we have to have the states put their own protocols in place, but there has to be a way to ensure that there's a more unified, universal approach to the handling of this pandemic. Because the borders are open, so people move from state to state. You can't say someone can move from one state to the other state. I mean, we did border closures. They were not especially effective, but people move from state to state. So if one state is not handling their response as they should, it's going to adversely affect other states.
Now let's talk about the issue of the fake COVID test certificates that the Lagos State Commissioner for Health spoke about. I mean, how much of a danger does this pose, seeing the rising number of cases that we are witnessing?
This is so disheartening, to be honest with you. It's so disheartening because, I mean, people saw that on the news, and I'm sure people didn't even believe that that was true. But I can tell you that I do know people that actually did receive that offer of, or we're going to give you a fake COVID test. And it's disheartening because if we can't even rely on the processes and the protocols that we've put in place, we can't rely on individuals and our society to adhere to these protocols, then what hope do we have? So if someone can have COVID-19 and just basically walk onto an airplane with a fake test and put every single person at risk, it's very, very disheartening and it's very, very troubling.
So are you confident that we will be able to curb all of these sharp practices, because the government is looking to put measures in place to address it?
Definitely, we can curb these sharp practices. We just need, when it comes to public health policies, there's an arm that relies on enforcement. There's no way we can do this without enforcement. So what? I mean, I saw some undercover operation that one of the news stations did. These are ways that you can actually identify individuals involved in this practice. If you make an example of one or two people, there will be a difference moving forward.
And that's the issue for some persons, if I may cut in, that no one has been made to pay for all of the sharp practices. Perhaps that is why it is thriving.
You're absolutely correct. If we don't make an example of one or two people, it's going to continue. I mean, watching that news segment where there was an undercover operation, and in my mind I was saying, oh, we finally got these people. But then at the end of the day, I was like, wait, nothing happened? Wait, what happened actually? So we have to make an example. This is serious. People actually die, have lost colleagues in the medical profession with this disease. People need to take this very seriously. Someone needs to be made an example of so that these sharp practices can finally stop.
Now, one aspect that I'd also like for you to touch on is the aspect of those health workers on the front lines. Recently, we lost about 20 health workers in 1 week. And a report yesterday said we have lost 4 doctors as well. And we know the number of doctors that are available in the country. When you place that side by side, the population in the country, what concerns do you see moving forward?
It's very, to be honest with you, one of those 20 doctors that was lost was a classmate of mine, someone I knew very well. So he was a very sharp mind, one of the very, very sharp minds in his field. So we're losing these people. We're not training enough doctors. We're not graduating enough doctors from medical schools. We don't have enough medical schools in the country. The people that we do graduate, they all migrate abroad. I mean, in my class, I think at least 80% of my classmates don't live in Nigeria. So with the few of us that are left, are dying to this disease because people will not wear a face covering, because people will be sick and walk into their doctor's office and you ask them, do you have a fever, do you have a cough, do you have runny nose, and they say, oh no, we don't. Some people have actual positive COVID tests and still walk into their doctor's office and claim that they are fine. So they put people at risk. We don't have enough doctors to lose. So this is another thing that is very, very concerning. We're losing too many healthcare professionals, not just doctors, nurses. We're losing too many of them, and we don't have enough.
And so if we are to have a holistic approach, perhaps a national approach to addressing this issue, seeing the number of rising cases that we are having, what would that be from your point of view? So
a holistic approach, to be honest with you, this is not rocket science. It goes back to everything we've said in the beginning of this pandemic. So this virus needs people to be in close proximity for it to be transmitted. So the first thing you do is you ensure that people are not in close proximity. You have a national guideline preventing mass gatherings. And those are the places where these things are transmitted. If you have to be outside, you wear a face covering. Because again, like I said, the virus is looking for individuals, looking for susceptible hosts to infect. So if someone that has an infection, and we know people do have asymptomatic infection, if you have asymptomatic infection and you're wearing a face covering, the virus has nowhere to go. So that by the time your infection abates and you're fine, that if you ended up not transmitting it to anybody. So that's what we're pushing. If you don't have to go out, don't go out. Wash your hands regularly. I mean, it sounds so simple. So people are always asking us, what else can we do? What else can we do? But these are the things that work. These things have worked in a lot of Asian countries, as we can see. It's the same thing. It's simple. But these things work, and these are the things that we need to enforce on a national level, not just on state level.
Now, this seems to be on the part of the people. On the part of the government now, what more should they be doing to address and have a nationalistic approach at addressing this pandemic?
So like I was saying, on the part of the government's role is to act policy that makes sense and that work, and to enforce. So those are the things that the government has to do. So the policies, we already know the principles that we need to adhere to. Now, enforcement is key. But the other thing I touched on earlier is community engagement. Government cannot just come and give us a bunch of rules and regulations and then walk away. They can enforce. I mean, in the past few days, a bunch of mass gatherings were broken up. I mean, we saw that. But we want to do more. The government can engage with the communities. The government can do this. You know, they can go down to the grassroots and actually get the buy-in of people, let them understand why it is that we have these protocols and policies in place. And it's easier to get people to adhere at that point. So these are the things that the government can do. The things that we need to do, we already know.
Right.
The things that the policies, we already know. The problem is getting the people to actually adhere and enforcing these protocols.
But when you look at enforcement, you would recall all of the instances that took place even during the first lockdown, where we saw that it was reported rather that some security officials were allowing, people travel across states where it wasn't supposed to be. We saw all of those sharp practices as well. I mean, enforcement, what more can be done?
Yeah, I mean, you're absolutely correct. I mean, and that brings us to the Nigerian factor.
Right.
It just brings us back to the Nigerian factor. I mean, I know people that said, oh, I wanted to travel from here to here, and I just paid 5K to 5,000 naira to the people at the border, and just let me go. Someone said, I just paid 2,000 naira. I mean, this is a Nigerian factor. And that's one of the things that is impeding our response to this pandemic. So, but like I said, if there's political will and one or two people are made an example of, I think that will make a lot of difference. And that's my opinion.
All right. Public Health Specialist and Public Relations Officer, Association of Public Health Physicians of Nigeria, Lagos State Chapter, Dr. Blossom Mado Afokwa. Thank you for your time on the program.
Thank you so much for having me.